this is a suffering in the young generation, not simply in older generation, because people are hesitant to talk at the older generation. And I chose to do this topic mainly because there are a lot of things which can be resolved at early stage of life. So the sexual dysfunction in young. Okay. Now, when you talk sexual dysfunction in males and females, can be different. And when you call sexual dysfunction, it does not always mean erection difficulty. Okay. So don't take that if it's all talk about today's topic is erection difficulty in males. It's all about sexual dysfunction in a young population. And this could be male or female. So it's very important to understand that these things can happen in both the sexes and can happen not simply as erection difficulty, but also as sexual dysfunction per se. Now, I don't want to go into technicalities of what is sexual dysfunction. You can look at Google, the standard medical diagnosis. You can have the different format, different questionnaire, which can be filled up. Again, that's a very technical, which can be done by a psychologist or an endocrinologist who can understand your sexual dysfunction. But the main question is, what are the different types of sexual dysfunction? So sexual dysfunction is basically about that, the whole sexual satisfactions per se, and during the sexual intercourse is called sexual dysfunction. And people can have right from the word desire, so which is called libido, or the act of sexual, which is sexual intercourse. So the question is more about that, uh, uh, what is your suffering from? So particularly if you talk about the young males, it is the erection difficulty, which can happen in young people. Our data suggests that can happen in young people, and forget about the older 40s and 50s and 60s. Definitely by age-related sexual dysfunction is very common. Menopause sexual dysfunction, diabetes-related sexual dysfunction is common. I'm just talking about sexual. So it can happen because of the lack of satisfaction, lack of sexual relationship, and besides having erection difficulty in males. So, so the sexual erection difficulty is quite common, and this tends to be much more related to several factors. Now, if you feel that you're suffering from any of this spectrum, then you have to meet, especially in males, you have to meet an endocrinologist, because this can be mainly because of either psychological or physical illness, indirectly certain medications causing it, or certain hormonal disorders causing so sexual function. Now, the question is that how would you know as a patient why discuss with the doctor if the GP is not able to come to the oncologist? Because there could be certain simple basic psychological issues, misunderstanding, or relationship issues, or certain medication which can cause it. So, what I would suggest that if you are suffering from any sort of sexual dysfunction, which is broad spectrum, which includes erection difficulty as part of the problem, then you must discuss with your GPs, a physician, or endocrinologist. Now, what do we do? What are we going to do about it? Definitely, we're going to identify where is the problem. Is it psychological? Is it physical? Or is it the hormonal issues which is causing the problem? Or is it really medical problems? Or is it some relationship issues, which can be relationship issues that you can be discussed with a psychologist and psychiatrist? But is it medications, or is it certain hormonal disorders which might be there at a younger age, which may not have been picked up or more overt because of your demands after 18 and 20 years old? So it's very important to discuss that issues. Now the question is, what are the tests? What are you going to do? First thing is very important. The history is very important from my point of view. What led to be? Is it slow, sudden, or gradual onset, especially in males? Is it sexual dysfunction of any time, which includes the desire to libido at what time it happened? At the same time, if the act of erection difficulty happened, at what time was it sudden or gradual, or anything which precipitated it? That's very important for us to understand. Now, we also do what you call is, in case of males, we do the secondary sexual characteristic. We examine the male hormones, which is responsible for like hair growth, shaving your hair, and different characteristic. That's what we tend to watch. Now, besides that, we also look at the drug history. Is it a drug which is causing the trouble? And also, we try to do certain tests. Now, for example, the prolactin, which is one of the hormones which is can go up with several drugs and which can cause sexual dysfunction. I must warn you that large number of population are popping on a pill which has got domperidone. Now, large number of medications which can contain, there are like Pantocid DSR, Pantocid D, Razo D. The D component has domperidone. The pantoprazole or esomeprazole, that combination which is used for acid, cause sexual dysfunction. The medication can basically male or females can have sexual dysfunction. Either males or females dysfunction. Very important to I said other drugs, but it's very common to see patients take medications. The question is, what do we do? Obviously, if the drugs is a precipitating cause, then the drug, and if drugs is not the precipitating cause, we look at further investigations, which includes testing of prolactin, testosterone, sometimes thyroid dysfunctions, and also metabolic disease like diabetes, high cholesterol, hypertension, other reasons for sexual dysfunction. Now, after all these tests, so what I personally feel as a clinician, what is common among us, sorry. So what is traveling? So it's jumping up and down. So what are the common things which can happen and to cause sexual dysfunctions are particularly the obesity. So that's why I talk about sexual dysfunction in young. It's mainly because of the obesity, and obesity is a common cause of it. Lack of exercise, obesity is common cause of sexual dysfunction in young adults, including old adults. A. B. Diabetes is common. If you have diabetes, sexual dysfunctions, including erectile difficulties in male, is very, very common. 3. Smoking. Smoking can cause sexual dysfunctions. A lot of international world smoking packages have clearly demonstrated the indirect sign of sexual dysfunctions right in the picture of cigarette packs. So a lot of Western worlds have clearly allowed that picture to be shown, which clearly demonstrate that in males the sexual dysfunction can happen because smoking is fairly common, still common in our younger age group. So it's very important to understand that obesity, diabetes, smoking, lack of exercise are common cause of sexual dysfunction. Definitely certain hormonal disorders can cause it, certain drugs can cause it. So it's very important that you speak to your clinicians and endocrinologists and understand that what sort of difficulty that you are suffering from. And it's very important for the clinicians to look into the drug history because there are certain drugs, as discussed, can cause sexual dysfunction, and also important to understand the certain test which needs to be done so that we pick up in certain chronic disease, chronic use of any medications, especially the chronic psychiatric medications can cause sexual dysfunctions. And at the same time, say that what we tend to find are the drugs, diabetes, are the common cause. There are certain class of population who have been overusing product which you go to the system and they start using what they call the plant supplements, the protein supplements. It's not uncommon to see this disorder because there are protein supplementations which is internationally branded, can cause hormone disorders, which is very common. I think now taking supplements disorder or sexual dysfunction. So it's very important to decide what is the reason. But what they not, we find that relationship, psychological issues, watching a lot of television, sitting on screen all the time can lose to sexual dysfunction. So it's very important to talk about it, talk to your GPs, talk to your endocrinologists, and see that what are the problems that you're suffering from. And I would say that one third of the population in our country, less than 30-35, may have some degree of sexual dysfunction. And our studies also suggest that people with diabetes, younger or older, have 2 to 3 times more risk of having sexual dysfunctions compared to the normal population. And this disease needs to be taken seriously because sexual dysfunction, particularly erection difficulties, are also a reflection that your arteries are getting blocked. Because when you have sexual excitement, the poor arteries tend to get filled up. The arteries tend to get filled up with the blood vessels, and if the blood supply is not sufficient, it means that the overall blood supply across the board into the other heart or to the renal arteries or to the other arteries may not be sufficient. So it is a reflection of what we call as a vascular disease. So it's very important to understand that it should not be taken lightly. Could be just psychological, it could be drug induced, it could be what we call as metabolic disease because of lifestyle, and obesity, diabetes, hormonal disorders can be the different reasons for sexual dysfunction. The most important that if you think, look, you don't have that particular problem, which is very minor, the commonest thing is your lifestyle, lack of exercise, and weight reduction is the main mantra for if you have any degree of sexual dysfunction. And if you have that, then please, you can do it without consulting a doctor, which is all often. So you have to understand that obesity, diabetes, metabolic, lack of exercise, smoking. And if you stop smoking, start exercising, majority of the sexual dysfunctions can be resolved, especially if it's a slow onset. If it's a sudden onset because of drug being precipitated or psychological issues, you can discuss with your psychologist, discuss with your partner, and understand more about it. Because this needs to be taken professionally. And what I'm worried about that this country has a very young population which has got obesity, which has got huge lack of exercise. They think they understand everything about it, but couple because fertility. See, menopause difficulty because of the way the God has designed the whole sexual process, because of erections from the male partner and the female partners tends not to have any erection difficulty directly, but as long as the females are concerned, they tend to have more sexual dysfunctions, the desire right from or painful sexual act, which needs to be seen by the gynecologist as well. But you need to speak to a doctor. If you're a female, you can meet with gynecologist and meet endocrinologist, or meet with the GP or physicians we are comfortable with, but talk about it, understand about it. And also these are very treatable conditions. Majority of them are can be solved, but certain metabolic disease like diabetes, obesity, smoking needs to be improved the lifestyle changes, and that can improve your sexual dysfunction. So very important to understand and talk about it, go into much deeper. And if you have any issues, speak to your doctor. That's what the main mantra about it. And if you have any questions, I'm happy to take on. So the question is about I've stopped smoking and still have erection difficulty. That is unfortunate because even a younger age population, the smoking can cause erection difficulty, which may remain. I think the best is to wait for it. And if you think you've not improved, then better to see an endocrinologist and understand why it is. Could be good. There could be associated hormonal issues which can cause it. But yes, sometimes the smoking related erection difficulty can be reversible, and you need help of medications to support your erection difficulty. The question about is a masturbation is a supposed to be causing depression about? No, it should not be. Vivek Agnihotri, that's a normal response, and there should not be a reason for sexual difficulty. And you're depressed. I don't think you should be depressed about what you're doing, and it's a normal response of human body, a normal desire, and you should carry on, and it should not affect your erection difficulties. I think, Richa, you should consult your doctor because that could be simple, some problem infection or some problem with your lining of during the act, which could be dealt with your gynecologist, and it could be simple infection, Richa Bansal. Likely that before the other periods can be pregnant, but it's better to do the testing. That's the best way. And following the cycle, there are a lot of apps you can use it to be safe in pregnancy. Any questions? Any more questions? No more questions. So please, happy to send me questions. I'll be happy to reply that. But make sure you discuss about this with your GP, doctor, endocrinologist, urologist, or gynecologist, and we'll be able to solve the problems.